Okay, Diane, please go ahead.
Thanks, Chief Broschard. As you're probably aware, there was some challenges with ambulance services over the weekend. There was a lot of concern expressed on social media and some assumptions made. And so, related to this, are we able to increase ambulance services under this situation? And can you talk about kind of the levels of service that we have an agreement for, and kind of why there isn't more ambulance services, and sometimes they get spread out to a point where there's no ambulance service?
Sure, I'll do my best. So I think you're referring to Saturday. This Saturday was a very challenging day for the system. It was a very busy day, and it's for all the reasons that I think I've brought to your attention in the past. So in my personal opinion, EMS is essentially at a crisis point, not just in Contra Costa, but throughout the state and the nation. I happened to be at an event that I'll talk about a little bit later, and I was talking with the fire chief of the Sacramento Metropolitan Fire District, and their challenges are even more extreme than ours. We have made some changes. If we go back to September, we have increased the total number of ambulances deployed from 54 per day, and they're not all deployed at the same time. There's obviously more during the day and less at night, to 70 ambulances per day. The difference being the basic life support ambulances of 16 to 18 ambulances per day that are deployed in the system to try and decompress some of the 911 service demand, and the hospital delays, which are ongoing, constant, and unrelenting, and not getting much better. Certain days of the week, and I cannot tell you that there's a pattern to this because we have looked and there are not distinct patterns, but Saturday was a day where the system just absolutely got hammered, and there were many instances where in certain locations, particularly out in the east, there were no ambulances available. The ambulances that were available at that point may have been in the central core of the county or out west. And so we call those essentially level 0 events. We're not very creative. Level 0 means that there are 0 ambulances available. So if a 911 call comes in, that call has to be pending until an ambulance becomes available. Either it's released from the scene of a call, or it's at a hospital and that patient care has been transferred and that ambulance now becomes available to respond to a call. So we have increased dramatically the amount of ambulances. However, as I think I've stated many times before, trying to find paramedics is darn near impossible. So we cannot increase the number of paramedic ambulances that we have available. We can increase the number of basic life support EMT ambulances. Now, right now we're transporting about 45 patients per day with BLS ambulances, and approximately 200 to 220 per day with ALS ambulances. Demand continues to, I wouldn't say sharply increase, but it's there. And then certain days of the week, which I can't say is a constant. I can't say that it's every Saturday. But if you look at Saturday and then you look at Sunday, apparently nobody was really sick on Mother's Day. So Sunday was a relative breeze as compared to Saturday. And we see that whether it's a Monday or a Tuesday, it just sort of rotates. There are some events, if it's the first 100-degree day, that likely will increase demand. But other than those sorts of instances, it is an unfortunate circumstance where the EMS system is just really, really stretched thin. And for all the things that we've talked about, trying to reduce reliance on 911, trying to increase the types of tools and quantity of tools that we have in our toolbox, we are doing that. And part of my fire chief's report, I'll talk about it now, on May 8th or 9th, I think it was the 9th, I think we had almost 30 people present. Our staff, hospital administrators, hospital staff, the county EMS agency, as well as our subcontractor, AMR, and some consultants working on an implementation. That was basically the kickoff to implement what's called nurse navigation. Nurse navigation is designed to take a 911 caller who is determined to not need an ambulance transport to an emergency room and get them service and help in some other form or fashion. So that is not something that is widely used in California. In fact, I think there's only one entity in Southern California, and then I think Southern Santa Clara County might be at the point of deploying that. Washington, D.C. EMS uses it, Seattle EMS uses it. It is something that we are moving forward. It is going to negatively impact the business side, if you will, the revenue, because we will be taking trips, if you will, or transports off the board, so there won't be revenue, and there's also an additional expense to pay for this service. However, we are at the point where we have to do this. The system is I'll say it's almost unsustainable from a logistics standpoint. It's not from a funding or fiscal situation. It's unsustainable because there aren't enough resources to keep up with the demand. We have also started to institute some offload policies at hospitals, where after a certain point in time, we become much more engaged with their staff to essentially work very aggressively with their staff to get that patient transferred to the hospital. But that's around 60 minutes. And so the state standard in, I think it was SB 40 or AB 40, I can never remember if it was an Assembly bill or a Senate bill. The declared state standard is 20 minutes 90% of the time. The county standard has been 20 minutes 90% of the time, I think since maybe 2010 or 2014. Nobody meets that at the hospitals, and there is virtually no entity that we can find that can engage the hospitals and force them to make system changes. Now, some of the hospitals have done their own changes. Sutter Delta has done a couple of things, and they have changed their issue tremendously, from being the worst performer to the best performer. And so we're hoping to duplicate those, but we haven't really seen that in the hospital environment. So Saturday was not a good day for the system. And I can guarantee you there will be more days like Saturday, but there are less days like Saturday than there were 6 months ago. And a lot of that has to do with some of the things that we've implemented up to this point.
I really appreciate your thorough answer, because I think people don't think about it until they hear the headline that there aren't any. And so understanding all of the things that contribute to this, and part of that is, as you kind of alluded to, is when do you call 911? When do you ask for an ambulance? When do you go to urgent care versus, calling your advice nurse? The hospitals are really working hard to try to, be able to receive ambulances quicker. I mean, there is a whole system of folks that need to learn how to use the system more efficiently. But like you said, it sounds like it's a whole system that we're trying to deal with. Is there a reason why we should have more ambulances servicing, or is this determined by population, or, and how often do we get to these zero? And you're saying it's happening less often. So I'm asking you these questions because I want people to hear it from the expert and to not be spreading information that's not true.
Certainly, I think adding more to the system is just adding more. It's not really looking at the root causes and trying to find solutions. The reality is that 911, while it's not free, essentially, there's no penalty to using 911. So we've seen an increase in call volume across the spectrum of service providers in this state, certainly, where there's just more demand than there is or are resources to keep up with that demand. My analogy about adding ambulances is similar to widening a freeway, but they all end up at the same destination, which is a hospital or hospitals or hospital system that is overburdened, overtaxed, and understaffed. And so if the freeway ends up in a 2-lane country road, but you have money to and funding and resources to put a 10-lane wide freeway, it's still all going to end up at the same 2-lane road. And so the backup, might be mitigated a little bit, but essentially the crush is still going to be there, and you'll all end up in the same spot. And so the system needs to be refined and changed from the very beginning, from personal health care, engagement with primary care physicians, to understanding the need of the 911 system. California is very, very heavily regulated in EMS, so there's not a lot of choice when we get sent somewhere. We don't have a lot of options on things to do. In other states, I've witnessed it in Arizona, where the provider, the ambulance, and the fire engine crew does an assessment on somebody and simply tells them, we're not taking you to the hospital. You don't rise to that level. Can somebody take this person, back to their hotel room? Can they get them certain care? But that's just not the way it is here in California. So it's very scripted and very mandated on how we transport folks. So there are a lot of tools being developed. A3, I think, and for our part in assisting A3 in the dispatch piece, A3, I think, will, once it's fully staffed and operational, will help, because in this county, the psychiatric emergencies are not transported by law enforcement, they're transported by ambulances, and we can only go one place. Again, very scripted, very mandated. We can only go one place, and that one place is overburdened, understaffed, and has wait times of 90 to 120 minutes to offload a patient. The nurse navigation system that I referred to, we have support from the local emergency medical services agency. We have support from our subcontractor, even for all of its potential negative impacts on the revenue stream. It is something that I'm fully supporting because I think it's somewhere we need to go. There are also other enhancements with the use of additional basic life support ambulances. I do think that will probably be something that we will continue to do and add those types of ambulances where we can, because we can find EMTs much easier than we can find paramedics. So there's a lot of different tools that are starting to be developed. Sometimes they take time. Nothing is quick and easy. But to just add more ambulances, I don't even think we could at this point if we wanted to.
Thank you, Chief. I appreciate it. I think people that get to watch this are going to have a better understanding of the circumstances.